Dallas, Jan. 8, 2018. Exercise can reverse damage to sedentary, aging hearts and help prevent risk of future heart failure if it's enough exercise, and if it's begun in time, according to a new study by cardiologists at Southwestern and Texas Health Resources. To reap the most benefit, the exercise regimen should begin by late middle age, before age 65, when the heart apparently retains some plasticity and ability to remodel itself, according to the findings by researchers at the Institute for Exercise and Environmental Medicine (IEM), which is a collaboration between UT Southwestern Medical Center and Texas Health Presbyterian Hospital, Dallas. And the exercise needs to be performed 4 to 5 times a week. 2 to 3 times a week was not enough, the researchers found in an earlier study. Based on a series of studies performed by our team over the past 5 years, this dose of exercise has become my prescription for life, said senior author Dr. Benjamin Levine, director of the Institute and professor of internal medicine at Southwestern. I think people should be able to do this as part of their personal hygiene, just like brushing your teeth and taking a shower. The regimen included exercising 4 to 5 times a week, generally in 30-minute sessions, plus warm-up and cool-down. One of the weekly sessions included a high-intensity 30-minute workout, such as aerobic interval sessions in which heart rate tops 95% of peak rate for 4 minutes, with 3 minutes of recovery, repeated 4 times, a so-called 4x4. Each interval session was followed by a recovery session, performed at relatively low intensity. One day's session lasted an hour and was of moderate intensity. As a prescription for life, Levine said this longer session could be a fun activity such as tennis, aerobic dancing, walking, or biking. 1 or 2 other sessions were performed each week at a moderate intensity, meaning the participant would break a sweat, be a little short of breath but still be able to carry on a conversation, the talk test. In the study, exercise sessions were individually prescribed based on exercise tests and heart rate monitoring. 1 or 2 weekly strength training sessions using weights or exercise machines were included on a separate day, or after an endurance session. Study participants built up to those levels, beginning with 3 30-minute, moderate exercise sessions for the first 3 months and peaked at 10 months when 2 high-intensity aerobic intervals were added. The more than 50 participants in the study were divided into 2 groups, one of which received 2 years of supervised exercise training and the other group, a control group, which participated in yoga and balance training. At the end of the 2-year study, those who had exercised showed an 18% improvement in their maximum oxygen intake during exercise and a more than 25% improvement in compliance, or elasticity, of the left ventricular muscle of the heart drive. Levine noted. He compared the change in the heart to a stretchy, new rubber band versus one that has gotten stiff sitting in a drawer. Sedentary aging can lead to a stiffening of the muscle in the heart's left ventricle, the chamber that pumps oxygen-rich blood back out to the body, he explained. When the muscle stiffens, you get high pressure and the heart chamber doesn't fill as well with blood. In its most severe form, blood can back up into the lungs. That's when heart failure develops, said Dr. Levine, who holds the S. Finley Ewing Chair for Wellness at Texas Health Dallas and the Harry S. Moss Hart Chair for Cardiovascular Research. He also holds the Distinguished Professorship in Exercise Sciences at Southwestern, which is celebrating its 75th anniversary this year. Earlier research by Southwestern cardiologists showed that left ventricular stiffening often shows up in middle age in people who don't exercise and aren't fit, leaving them with small, stiff chambers that can't pump blood as well. However, the researchers also found that the heart chamber in competitive masters-level athletes remains large and elastic, and that even 4 to 5 days of committed exercise over decades is enough for non-competitive athletes to reap most of this benefit. In the current study, researchers wanted to know if exercise can restore the heart's elasticity in previously sedentary individuals, especially if begun in late middle age. Previous studies from Dr. Levine's research program have shown substantial improvements in cardiac compliance in young individuals after a year of training, but surprisingly little change if the training was started after age 65. To start the study, researchers recruited 53 participants, ages 45 to 64. Many came from the Dallas Heart Study, which includes 6,000 Dallas residents and is the only single-center heart study of its size and multi-ethnic composition. The Dallas Heart Study is designed to improve the diagnosis, prevention, and treatment of heart disease. The new study appears in Circulation, a journal of the American Heart Association. Collaborators on the study included first author Dr. Erin Houghton, research fellow with UT Southwestern's Graduate School of Biomedical Sciences and the IEM, and now a faculty member at the Baker Heart and Diabetes Institute in Melbourne, Australia. Funding came from the National Institutes of Health and the American Heart Association. About UT Southwestern Medical Center. UT Southwestern, one of the premier academic medical centers in the nation, integrates pioneering biomedical research with exceptional clinical care and education. The institution's faculty has received 6 Nobel Prizes, and includes 22 members of the National Academy of Sciences, 18 members of the National Academy of Medicine, and 14 Howard Hughes Medical Institute investigators. The faculty of more than 2,700 is responsible for groundbreaking medical advances and is committed to translating science-driven research quickly to new clinical treatments. UT Southwestern physicians provide care in about 80 specialties to more than 100,000 hospitalized patients, 600,000 emergency room cases, and oversee approximately 2.2 million outpatient visits a year. Disclaimer: AAAS and EurekAlert are not responsible for the accuracy of news releases posted to EurekAlert by contributing institutions or for the use of any information through the EurekAlert system.